Hi there, welcome to this short video, Why should I incorporate implant into my practice? Brought to you by Born Dentist. Why should I do implants is a prominent question that comes to our mind as a general dental practitioner. To find answer to this, let us for a moment think from a patient's point of view who has lost a teeth and needs replacement. What do they want from an artificial tooth? And what are the choices that we as dentists can offer to them? Technically, we have three choices: RPD, FPD and implants. Let us critically analyze these choices based on their requirements. Well, everyone decides to have an artificial tooth closer to a natural teeth. So always the comparison is with the natural teeth. Hence, if you look at the qualities of natural teeth that an artificial teeth needs to copy, there are 6 to 7 properties or qualities that are to be compared. The number one preference would be to have a fixed teeth like the natural counterpart. Now, of the three options, one is removable and the other two are fixed. So if you rate these three prostheses based on retention and stability, RPD is a loser. Both RPD and FPD relies on abutment teeth for retention, stability and support. And some RPD also relies on edentulous alveolar ridge, which fastens their resorption. This is the weakest link in both these prostheses, because when abutment teeth are overburdened and they fail, both these prostheses also fails. Whereas implant engages the alveolar bone for retention, stability and support just like natural teeth. And during the process, no damage happens to adjacent teeth as there is no abutment teeth. The more importantly, it maintains bone. The next preference is to have a teeth which is strong enough to bite on anything hard. Now this ability is directly related to support. Well, it is proven that the chewing efficiency of RPD is only 30% compared to natural teeth because of its poor support. So if we can rate this prosthesis based on the three vital properties, implants scores more compared to FPD and RPD in retention and stability. The next most important criteria is aesthetics, and it depends on the ability to mimic natural teeth in appearance. As implant emerges out of the soft tissue, just like natural teeth, it gives an emergence profile similar to natural teeth. In contrast, emergence loss happens with FPD, with the soft tissues under the appendic recedes faster. Now with RPD, one advantage is that it can replace both hard and soft tissue loss in appearance. Thus, if you rate this prosthesis based on aesthetics, RPD gives better aesthetics compared to FPD. On ideal conditions, implants give better aesthetics than the other two prostheses. But on less ideal conditions, both implant and FPD requires extensive soft and hard tissue augmentation to provide sufficient aesthetics. So it is fair to give similar points to RPD and implant in terms of aesthetics. But the most important property that one would like to see in artificial teeth is prevention of hard and soft tissue collapse following tooth loss, that is preservation. No artificial teeth except implants can prevent this loss by maintaining the alveolar bone. This is a big plus compared to RPD and FPD. So here also implant scores more over RPD and FPD. Finally, the ultimate property that one needs to consider when comparing the types of artificial teeth is the success rate. Let us first look at the progression of an FPD. The abutment teeth are prepared and the final prosthesis is cemented. How long does it last? As the bone resorbs under appendic, there forms a gap and food starts to collect under FPD. This results in inflammation and secondary caries sets in, resulting in pulp devitalization and chronic periapical abscess which is failed to control by routine measures. This leads to extraction of involved abutment teeth and a new FPD is planned, preparing to the next tooth in arch and a new FPD in place. Coming to the same question, how long does it last? The same process is going to repeat again and again. With implants, over a period of time, soft and hard tissue adapt to current conditions, as you see happening in this picture where the interdental papilla between the molar implant and the adjacent premolar teeth. This is because the implant maintains the bone at the edentulous area. Now let us just compare the failure or success rates of FPD and implant. Look at this chart showing various studies of failure rate, and it is anywhere between 25 and 30%, which means the success rate is 70% approximately. And the average lifespan of an FPD is 10 to 15 years. So it is safe to assume that the success rate of FPD is 75% in 10 years. When we compare this with the success rate of implant, we will appreciate that most of the studies give implant a success rate of 90 to 95% in 10 years. But it is worth to note here is that the FPD has a very long track record of more than 50 years, whereas the literature support for the current version of endosteel implant is anywhere between 15 to 20 years. But even in this short span, the success rate of implant is above 90%. Now what this means is that when 75% of FPD fails in the first 10 to 15 years owing to caries or fracture of abutment teeth, 95% of implants are still in service. The result is greater in single tooth replacements. Isn't it great? The single factor makes the implant the favorite choice than RPD and FPD. And one other thing is that when an FPD fails, it fails with it 2 or more abutment teeth as well, which is not the case with implant. So looking at the old chart, implant scores again in success rate as well. So whatever way you look at it, implant is a better choice compared to all other forms of artificial teeth. Finally, coming back to the initial question we had, the answer is we should incorporate implant in our practice because patients benefit from having an implant. The sole reason why world over the dentist recommends implant as their first choice and the best choice. So with that, we come to the end of this short video, why implants. Hope it was beneficial for you all. We all will love to hear from you. So please do give us your feedback in our website or through email or WhatsApp. Catch you with our next video. Until that time, this is Dinesh Narendran signing off from Bond Dentist Studio. Bye and all the best.